My dog injured his leg today while chasing a ball. He's limping, but it doesn't seem that bad. Is it safe to give my dog aspirin? Great question. I'm really glad that you asked this. Accidental intoxications and overdoses is probably one of the more common problems that we see in the veterinary emergency room. And this can be completely avoided altogether by knowing about the risks of over-the-counter medications in your home. It can be really tempting to reach for something in the medicine cabinet, but most human over-the-counter pain medications are not safe to give to pets. 20 to 30 years ago, people used to recommend giving aspirin to dogs. Now that we have a lot more information and data, it's no longer recommended to give aspirin for pain. The toxic dose overlaps with the therapeutic dose, meaning that if you're giving enough to help with the pain and inflammation, you might be giving enough to cause harm. Most over-the-counter pain medications fall into the general class of drugs called non-steroidal anti-inflammatories, or NSAIDs. TYLENOL is a little bit different. It's not technically an anti-inflammatory. It works by a different mechanism, and it helps to reduce the pain threshold. Regardless, ibuprofen, aspirin, TYLENOL, Aleve, Advil, NAPROXEN can all be very harmful and toxic to pets. Anti-inflammatory medications can cause side effects even when used according to the label instructions. The most common side effects are gastrointestinal, like stomach ulcers, and kidney injury. Aleve or naproxen is one of the more toxic substances, and depending on the size of the dog, even a single Aleve tablet can land them in the hospital or be potentially fatal. Same thing with TYLENOL in cats, absolutely contraindicated. Cats are unable to metabolize TYLENOL properly, and even very small doses can be very toxic to them, causing problems with their blood. The other problem with reaching for something in your medicine cabinet is that there is typically a 7 to 10 day washout period on anti-inflammatories, meaning that after you've given your dog a single subtherapeutic dose of aspirin, your vet is then going to have to wait an additional 10 days before he or she can prescribe an anti-inflammatory without potentially risking causing side effects. The worst intoxications that we see are pets that get into bottles of ibuprofen, aspirin, Aleve, TYLENOL, and I can't tell you how many times I've seen a dog get into an owner's purse when they're not looking, or get up on the counter and get into medications and essentially eat the whole bottle. This can be very serious and very expensive. Always make sure that you keep all medications and supplements out of the reach of children and pets. Resist the temptation to reach for human over-the-counter pain medications, and always check with your veterinarian or have your pet evaluated in order to get a medication that is labeled for pets and that is safe. Even in healthy pets, all of the NSAIDs do have the risk of potentially causing side effects, and so they always need to be used according to the label instructions. And if you're noticing any concerns like poor appetite, vomiting, diarrhea, or depression, they should not be given, because those symptoms could be an early indication that they are developing side effects. And if you continue to give the medication, that could make it worse. And please visit the ASPCA Animal Poison Control website for a list of other household dangers so that you can keep your pet safe. I hope that helps to answer your question, and take care.